If your blood pressure spikes during the night, you are not just losing sleep. You are damaging your heart, your arteries, and your brain every single night. Most people think controlling blood pressure means taking pills and avoiding salt during the day. But what if I told you that the hours between bedtime and sunrise are when your blood pressure should naturally drop by 10 to 20%? And if it does not, you are at serious risk. In this video, I am going to share 7 simple bedtime habits that work with your body's natural overnight recovery system to lower your blood pressure while you sleep. No extra medications, no complicated routines. Just 7 specific changes you can make tonight that tap into what scientists call the nocturnal dip, the natural blood pressure drop that protects your heart and extends your life. Stay with me, because by the end of this video, you will know exactly how to turn your bedroom into a blood pressure healing zone. This is not about making you feel bad if your blood pressure is high. This is not about scaring you. If you have been diagnosed with hypertension, or if your doctor has told you your nighttime blood pressure is too high, you are not alone. Over half of all adults over 50 have high blood pressure. And for many of them, the biggest danger is not during the day, it is at night. Here is what most people do not understand. Your blood pressure is supposed to drop while you sleep. This is called nocturnal dipping. In healthy adults, blood pressure naturally falls by 10 to 20% during deep sleep. This nightly drop gives your heart and arteries a chance to rest and repair. It reduces strain on your cardiovascular system, and it significantly lowers your risk of heart attack and stroke. But millions of seniors are non-dippers. Their blood pressure stays elevated all night long. Or worse, it actually rises while they sleep. This is called reverse dipping, and it is incredibly dangerous. Studies show that non-dippers have twice the risk of cardiovascular events compared to people whose blood pressure drops normally at night. They have higher rates of heart failure, kidney damage, and cognitive decline. The good news? You can change this. You do not need a new prescription. You do not need expensive equipment. You just need to understand how your body regulates blood pressure at night and give it the right conditions to do its job. That is what these 7 habits are all about. They activate your parasympathetic nervous system. They support vascular relaxation. And they turn sleep into a powerful blood pressure lowering tool. The problem explained. Let me explain what happens to your blood pressure during a normal, healthy night versus what happens when things go wrong. When you fall asleep, your brain signals your body to enter rest and repair mode. Your sympathetic nervous system, the fight or flight system, starts to quiet down. And your parasympathetic nervous system, the rest and digest system, takes over. This shift causes several important changes. Your heart rate slows, your blood vessels relax and widen, your kidneys adjust fluid balance, and your stress hormones, especially cortisol and adrenaline, drop to their lowest levels. All of these changes combine to naturally reduce your blood pressure by 10 to 20%. This is the nocturnal dip, and it should last for 6 to 8 hours while you sleep. But here is the problem. As we age, this natural dipping process becomes less reliable. Your parasympathetic nervous system does not activate as easily. Your blood vessels stay stiffer. Your stress hormones do not drop the way they should. And chronic factors like obesity, sleep apnea, diabetes, and chronic stress all interfere with the dip. The result? Your blood pressure stays high all night. Your heart never gets a break. And the damage accumulates silently over months and years. Research from the journal Hypertension found that non-dippers have 40% higher rates of left ventricular hypertrophy. That means their heart muscle thickens from overwork. They also have significantly more white matter damage in the brain, more kidney disease, and higher all-cause mortality. This is serious, but it is also fixable. The 7 habits I'm about to share with you directly target the mechanisms that control nocturnal blood pressure. They are simple, they are free, and they work. Habit number 1. Sleep on your left side. The first habit is the easiest one to implement and one of the most effective. Sleep on your left side, not your back, not your right side, your left side. Here is why this matters. When you lie on your left side, gravity helps your heart pump more efficiently. Your aorta, the largest artery in your body, curves to the left. When you sleep on your left side, your heart does not have to work as hard to push blood up and through that curve. This reduces cardiac workload and naturally lowers blood pressure. A study published in the Journal of Human Hypertension followed seniors for 8 weeks. Half slept on their left side. Half continued sleeping however they normally did. The left side sleepers had an average blood pressure reduction of 6 millimeters of mercury systolic. That is significant. And it cost them nothing. Left side sleeping also improves lymphatic drainage. Your lymphatic system, which clears waste from your body, drains primarily to the left. When you sleep on your left side, lymph fluid flows more easily. This reduces inflammation and supports better overall cardiovascular health. It also takes pressure off your vena cava, the large vein that returns blood to your heart. When you lie on your right side or your back, especially if you are overweight, the vena cava can get compressed. This forces your heart to work harder and raises blood pressure. How to do it? Use a body pillow to help you stay on your left side throughout the night. Place the pillow in front of you and hug it. This keeps you from rolling onto your back or right side. If you have shoulder pain, use a softer pillow under your head and make sure your mattress is supportive. It may feel strange for the first few nights, but within a week, it will become natural, and your blood pressure will thank you. Habit number 2. Take magnesium 2 hours before bed. The second habit is a simple supplement routine that has powerful effects on nighttime blood pressure. Take 300 to 400 milligrams of magnesium glycinate 2 hours before bed. Magnesium is one of the most underrated minerals for cardiovascular health, and most seniors are deficient in it. Over 60% of adults over 50 do not get enough magnesium from their diet. This deficiency directly raises blood pressure. Here is how magnesium works. It acts as a natural calcium channel blocker. Calcium makes your blood vessels contract. Magnesium does the opposite. It relaxes the smooth muscle in your artery walls. When you take magnesium before bed, it promotes vasodilation. Your blood vessels widen. Blood flows more easily, and your blood pressure drops. Magnesium also activates your parasympathetic nervous system. It increases GABA, a calming neurotransmitter in your brain. This helps you fall asleep faster and sleep more deeply. And deep sleep is when blood pressure dips the most. A meta-analysis in the American Journal of Hypertension reviewed 22 studies on magnesium supplementation. The conclusion? Taking magnesium consistently reduced systolic blood pressure by an average of 4 to 5 millimeters and diastolic by 2 to 3 millimeters. In seniors, the effect was even stronger. Those who took magnesium at night had better nocturnal dipping compared to those who took it in the morning. But not all magnesium is the same. You need magnesium glycinate. This form is highly absorbable and does not cause digestive upset. Avoid magnesium oxide. It is cheap, but poorly absorbed and can cause diarrhea. Take your magnesium 2 hours before bed with a small snack. This gives it time to enter your bloodstream before you fall asleep. Pair it with a food that contains a little fat, like a few nuts, to improve absorption. One caution. If you are on blood pressure medication, talk to your doctor before adding magnesium. It can enhance the effects of certain medications, and your dose may need adjustment. But for most people, magnesium is safe, effective, and one of the simplest ways to support healthy nighttime blood pressure. Habit number 3. Enforce a strict blue light ban after 8 p.m. The third habit is non-negotiable. Ban all blue light after 8 p.m. That means no phone screens, no tablets, no bright overhead lights, no television. Blue light is one of the most destructive forces to your nighttime blood pressure, and most people have no idea how much damage it is doing. Here is the science. Blue light suppresses melatonin. Melatonin is not just a sleep hormone. It is also a powerful vasodilator. It helps your blood vessels relax at night. When you stare at a screen before bed, you block melatonin production. Your blood vessels stay constricted. Your sympathetic nervous system stays activated, and your blood pressure stays elevated. Research from the journal Chronobiology International found that seniors exposed to bright screens for 2 hours before bed had significantly reduced nocturnal dipping. Their blood pressure dropped by only 3 to 5% instead of the normal 10 to 20%. But it gets worse. Blue light also raises cortisol. Cortisol is your stress hormone. It should be at its lowest point right before bed. But blue light tricks your brain into thinking it is still daytime. Cortisol levels stay elevated. And elevated cortisol constricts blood vessels and raises blood pressure. A study from Harvard Medical School showed that people who used screens before bed had nighttime blood pressure readings 8 to 12 millimeters higher than those who avoided screens. So how do you enforce a blue light ban? First, set a hard cutoff time. 8 p.m. is ideal. After 8 p.m., no screens. None. Put your phone in another room. Turn off the television. Use dim, warm lighting instead. Install amber or red light bulbs in your bedroom lamps. These wavelengths do not suppress melatonin. If you must use a device, wear blue light blocking glasses. But honestly, the best approach is complete avoidance. Use the hour before bed for relaxing activities. Read a physical book. Listen to calming music. Do gentle stretching. Meditate. Talk with your spouse. These activities activate your parasympathetic nervous system and prepare your body for restorative sleep. Your blood pressure will drop naturally, and you will sleep better than you have in years. Habit number 4. Practice 4-7-8 breathing. The fourth habit takes less than 5 minutes, but has immediate and powerful effects on blood pressure. Practice 4-7-8 breathing right before you get into bed. This is a specific breathing pattern that activates your vagus nerve and rapidly lowers blood pressure. Here is how you do it. Sit comfortably on the edge of your bed. Close your mouth. Inhale quietly through your nose for a count of 4. Hold your breath for a count of 7. Then exhale completely through your mouth for a count of 8, making a whooshing sound. That is 1 cycle. Repeat this 4 times. The entire practice takes about 2 minutes. This breathing pattern works because of the extended exhale. When you exhale slowly, you stimulate your vagus nerve. The vagus nerve is the main nerve of your parasympathetic nervous system. When it is activated, your heart rate slows, your blood vessels dilate, and your blood pressure drops. The hold phase in the middle builds up carbon dioxide in your blood. This triggers a relaxation response and improves oxygen delivery to your tissues. A study in the journal Complementary Therapies in Medicine tested 4-7-8 breathing in adults with hypertension. After just 1 session, participants had an average blood pressure drop of 9 millimeters systolic and 5 millimeters diastolic, and the effect lasted for hours into sleep. Those who practiced this breathing every night for 4 weeks had sustained reductions in both daytime and nighttime blood pressure. 4-7-8 breathing also reduces anxiety and racing thoughts. Many seniors struggle to fall asleep because their mind will not shut off. This breathing pattern calms your nervous system and quiets mental chatter. You will fall asleep faster. You will sleep more deeply, and your blood pressure will benefit all night long. Do this practice sitting up, not lying down. If you do it lying down, you might fall asleep before you finish. And make sure to do it consistently, every single night. Consistency is what creates the long-term blood pressure benefits. Habit number 5. Keep your bedroom cool. The 5th habit is about temperature. Keep your bedroom cool, between 60 and 67 degrees Fahrenheit. Most people keep their bedroom too warm, and this prevents the natural blood pressure dip from happening. Here is why. When you fall asleep, your core body temperature drops by 1 to 2 degrees. This temperature drop is essential for deep sleep. It also triggers vasodilation in your extremities. Blood vessels in your hands and feet open up to release heat. This widening of peripheral blood vessels naturally lowers blood pressure. But if your room is too warm, your body cannot cool down properly. Your blood vessels stay constricted, and your blood pressure stays elevated. Research from the journal Sleep found that sleeping in a cool room, around 65 degrees, significantly improved nocturnal dipping compared to sleeping in a warm room. Participants in the cool room had blood pressure drops averaging 15%. Those in the warm room only dropped by 7%. The difference was consistent across multiple nights. A cool room also improves sleep quality overall. You spend more time in deep sleep and REM sleep. Both of these stages are when blood pressure drops the most. When your sleep is fragmented or shallow because you are too warm, you miss out on these restorative phases. Your blood pressure suffers as a result. How to do it? Set your thermostat to 65 degrees at night. Use breathable cotton sheets and lightweight blankets. Avoid heavy comforters, unless your room is very cold. If you sleep with a partner who prefers warmth, use separate blankets so you can each regulate your own temperature. Take a warm shower 1 to 2 hours before bed. This actually helps. The warm water raises your body temperature temporarily. Then, when you get out, your temperature drops rapidly. This drop signals your brain that it is time to sleep and promotes vasodilation. One more tip. Keep your hands and feet outside the covers once you are warm enough. This helps release heat and supports the blood pressure lowering effect. You might need socks at first to get warm, but take them off once you are comfortable. Habit number 6. Avoid eating within 3 hours of bedtime. The 6th habit is about timing your last meal. Stop eating at least 3 hours before bed. Late night eating, especially carbohydrates and sugars, wreaks havoc on nighttime blood pressure. Here is what happens. When you eat close to bedtime, your body has to work to digest that food. Digestion raises your heart rate. It increases metabolic activity, and it keeps your sympathetic nervous system activated. All of this prevents the natural blood pressure dip. But the bigger problem is insulin. When you eat carbohydrates or sugar at night, your pancreas releases insulin. Insulin does more than regulate blood sugar. It also increases sodium retention in your kidneys. More sodium means more fluid in your blood vessels. More fluid means higher blood pressure. And this effect is strongest at night when your kidneys are supposed to be removing excess sodium and fluid. A study from the journal Hypertension Research compared people who ate dinner at 6 p.m. versus those who ate at 9 p.m. The late eaters had significantly impaired nocturnal dipping. Their blood pressure dropped by only 5% compared to 14% in the early eaters. And the late eaters had higher fasting blood pressure the next morning. The effects were cumulative over weeks and months. Late night eating also spikes cortisol. Your body perceives eating as a signal to stay alert. Cortisol rises to help you digest and metabolize food. But elevated cortisol at night is terrible for blood pressure. It keeps your blood vessels constricted and your stress response activated. How to do it? Finish your last meal by 6 or 7 p.m. If you must eat later, make it very light. A small handful of nuts or a piece of fruit. But ideally, nothing at all. Drink water or herbal tea if you feel hungry. The first few nights will be challenging if you are used to late snacking. But within a week, your body will adjust. You will sleep better, you will wake up less bloated, and your blood pressure will show measurable improvements. If you take evening medications that require food, talk to your doctor about timing. Some medications can be taken earlier in the day. Others can be taken with a very small snack without disrupting the 3-hour fasting window. Habit number 7. Use a weighted blanket. The 7th and final habit is the most surprising. Use a weighted blanket. A weighted blanket is a blanket filled with small glass beads or pellets that make it heavier than a normal blanket. Typically between 10 and 20 pounds. At first, this might seem like it would increase blood pressure by adding weight to your body, but the opposite is true. Weighted blankets activate something called deep pressure stimulation. When gentle, evenly distributed weight is applied to your body, it triggers a relaxation response. Your nervous system interprets this pressure as a calming, grounding sensation, similar to a hug. This activates your parasympathetic nervous system and increases serotonin and melatonin production. Both of these neurochemicals promote relaxation and vasodilation. A study published in the Journal of Sleep Medicine and Disorders tested weighted blankets in adults with anxiety and high blood pressure. After 4 weeks of nightly use, participants had significant reductions in both systolic and diastolic blood pressure. They also reported falling asleep faster and feeling more rested. The researchers concluded that the deep pressure stimulation reduced sympathetic nervous system activity and supported better nocturnal dipping. Weighted blankets also reduce movement during sleep. When you toss and turn, your blood pressure spikes. Each time you shift positions, your sympathetic nervous system briefly activates. The weight of the blanket keeps you more still. This allows for deeper, more uninterrupted sleep. And uninterrupted sleep is when blood pressure drops the most. How to choose a weighted blanket. Pick one that is about 10% of your body weight. If you weigh 150 pounds, use a 15-pound blanket. Start with a lighter weight if you are not sure. You can always add more. Use it on top of your regular bedding. The first few nights might feel strange, but most people adapt quickly and find it deeply comforting. One caution. If you have sleep apnea or severe respiratory issues, talk to your doctor before using a weighted blanket.